Well, hello there. It's Dr. Brian McCain, not just a chiropractor, Stanford, Darien-Dr.Brian. And as always, I apologize for the horrific name of my podcast. I wish I could change it, but we've been doing it for several years now, and it'd be too much work, too much of a technological challenge for an old person like myself. All right, having said that, today we're going to talk about the Ageless Athletic Knee Program. Now, that's a much better name than not just a chiropractor, Stanford, Darien-Dr.Brian. At least I hope you think it is. All right, here's what you got to think about is you're 50 plus years old. If you're lucky to be 50 plus years old, because some people don't make it to that point. And, you start to have a little issue when you're golfing with the knees a little creaky, or, you get up in the morning, it's a little wobbly on that one side, or even maybe both sides if and it wasn't that long ago, not many decades ago, you were very active. Maybe you consider yourself an athlete, or you wanted to be an athlete. But regardless, what ends up happening is the knees start to wear out. But they don't have to wear out. That's a big thing. They do not have to wear out. You'd be surprised at what can be done to ward off knee pain and hopefully prevent knee surgery and even knee replacement. I know a lot of people in their 50s are going for knee replacement because the pain's just that bad. But I think what happens is they're just not aware of alternatives. And that is what the Ageless Athletic Knee Program is all about. So if you're one of those people who have knee pain, and there's a lot of us out there who do, there are ways to mitigate the pain and to enjoy a full active lifestyle, a completely full and active lifestyle. So first of all, as I mentioned, I'm a chiropractor, tisk. But what happens here is a lot of knee pain is because the muscles, there's an imbalance in the muscles, either from the foot or from the waist down, that put pressure on the knee. And the knee is a delicate joint in some ways. When the knee is locked in extension, that's when your knee is fully, like if you were kicking as far out, keep your legs straight, that's extension. Now, if you were to stand there and just let your knees go to relaxation, you're not locked out. So it really takes a lot more effort, a lot more pressure on the meniscus. Now, what is the meniscus? The meniscus is that disc, that cushiony disc between the tibia and the femur. Okay, not so much the fibula. The fibula is that accessory bone on the side. If you listen to college, or if you listen to football, Daniel Jones, the former quarterback from the Giants, the New York Football Giants, who's been playing with a broken fibula, just tore his Achilles. Anyhow, so the meniscus really separates the two things. And when you hear the term bone on bone, you're probably irritating that meniscus to the point where there's not much less. That's when they'll say, okay, when it gets really that bad, you come in, you get a knee replacement. Or if it's not needing a knee replacement, what can happen is you're going to have a, surgical, come in, nip out some of the cracks in the meniscus. But fear not, there are things you can do to mitigate that. All right. So one of the things that I have found personally is a soft tissue technique called trigenics. And trigenics helps reestablish the neurological connection between the muscles and the somatosensory cortex that lies in the parietal lobe of your brain. Kind of like if you put your hands on your ears, put both hands on both ears, and you put your middle fingers together, that's the parietal lobe area. Okay, it deals with position sense. It tells the brain where your pinky is. It tells your brain where, the meniscus. It also tells your brain where those muscles are firing if you have the right afferent nerve intervention from the muscles. Okay, there's two types of nerves that inhibit pain. They're called muscle spindle cell. The other one's the Golgi tendon organ. And if these things are working properly, you may not have knee pain most of the time. If you are having knee pain and you correct it, you'd be surprised at how much less knee pain you have if you have any knee pain left at all. So the traditional approach is, okay, cortisone injections, which take out inflammation. Now, if you've inflamed the joint, you take out the inflammation, but you don't take out what's causing the inflammation. Think about that. You have to understand what is causing the inflammation. So if the muscles aren't working properly, or think of it this way: is your brain not being able to see those muscles properly. So it's kind of a bit of a problem, you might say. But a muscle is overlooked so often, and I'm telling you, so often, is the popliteus. Now, the popliteus, like the Pope in the Vatican, the popliteus is a muscle behind your knee. And anytime you have swelling there, if you go to 10 different doctors, I don't care, chiros, orthos, podiatrists, you go to physical therapists, they're going to tell you it's called a Baker's cyst because it's swollen. Now, is it really a Baker's cyst or just because that's what we call it if you have swelling back there? Well, it's a very simple test. It's a muscle test to see if the popliteus is firing properly. So what you would do is you'd be laying face down on the table, on the treatment table, and you'd have that leg up to one's affected, and you would turn the foot in. The practitioner would come in, try to mobilize that. If you can't hold that position, popliteus isn't firing, which means you cannot lock the knee in extension. And that's a pretty serious problem right there, because you can't lock the knee in extension. You are going to irritate and possibly inflame the meniscus and wear it away sooner. Not a good idea. So what happened is a few years ago, I mean, listen, I'm not immune to having knee pain myself, but I found a therapy unit device called the Knee on Track. The Knee on Track is a device that helps your synovial cells. Now, synovial fluid is what you get injected with when they inject hyaluronic acid into the knees for gel shots. They're called gel shots mostly. And it's typically hyaluronic acid is put in there into the knee joint to hopefully lubricate. But now if you can naturally lubricate that, it's going to be more effective, wouldn't you think? Because the gel shots kind of have less than a 40% success rate, and it lasts maybe 4 to 6 months if you're lucky. Hey, listen, if you're lucky, great. Knee problem is solved, and you can be as fully active as you want, and you're not doing further damage. But the idea here is to stimulate the synovial cells to produce more, or synoviocytes, which is a synovial cell, to produce more synovial fluid. And that's exactly what the Knee on Track does. Now, as luck would have it, Core Health in Darien is the only facility in Connecticut with the Knee on Track. And it's kind of surprising because with so many different knee problems out there, I mean, people just go for the knee shots. They take Advil, you do physical therapy, you try to strengthen it, or you stop being as active. Problem, let's not get less active as we get older. Let's go kicking and screaming. Stay active. That's my bit of advice. So what happens is we came up with not as a core part of our, Ageless Athletic Knee, good name, I think, for the program, is to help produce more synovial fluid. So that's going to be probably one of the most important parts, but it's not the only part. And when you have more of the synovial fluid, there's going to be less pain and stiffness naturally, okay? So it's a traction unit. It's not painful, but it's very effective. Now, the next thing we do that I already mentioned is the trigenics. And trigenics is what allows us to stimulate the muscle spindle cells, which then helps signal the afferent, or the signals that go from the location of your pain to the spinal cord up to your brain, where the brain recognizes it and runs the show. The brain is that main part of your body that runs the show. So when we reconnect those, okay, you'd be surprised at how much less pain you can have, because the signal it's a feedback loop that's working properly. But it's not just enough to work the popliteus. There's several different muscles you're going to have to check: the rectus femoris, even the glute max, your medial hamstrings, lateral hamstrings, vastus medialis, vastus lateralis. You can also work the superior patellar tendon and the inferior patellar tendon for stimulation of the Golgi tendon organ, which is the other type of nerve that inhibits pain. If you remember correctly, I just mentioned a little while ago, people, you have Golgi tendon organs and muscle spindle cells that help inhibit pain when they're properly connected. And the afferent are the signals that go to your brain. So by identifying which of these muscles are not working, not just the popliteus, but the popliteus is a very big driver. I'm going to tell you something. When you do work the popliteus, it's a little sore when you do it because that swollen muscle been like that for a while. So when you get that injected with cortisone, hey, you will feel better for a few days and maybe longer with the cortisone, but it takes out all the inflammation. But now you have that causation factor that's not been addressed. So going from the top, we're going to do trigenics for the knee muscles to make sure they're all working properly. The other thing we'll do is we're going to put you on the knee on track to help stimulate synovial fluid production. All right, so that's a good 2 legs to stand on, but guess what? It's not enough for what we do here at Core Health. We're going to do cold laser. A cold laser, it's kind of a thing, is that it doesn't really come out cold. It's just not hot, okay? You may feel a light warmth, but that's about it. You're not going to feel much more. And what happens is it helps the cells heal naturally, promotes natural healing in the cell itself, which is very, very important because the healing allows for a smoother operation of the particular muscle. And it's also going to help as far as reduce the stress and inflammation and ease the joint distress. So it's kind of pretty damn good. Now, some of the other stuff that I've really found to be very, very helpful is more of a weightlifting technique. It was bodybuilders started, but we use it here for knees, and it's called whole body vibration. Okay, the whole body vibration is not the whole thing. You stand on this plate that shakes the bejesus out of you. What we typically do is we combine that with blood flow restriction bands. So blood flow restriction bands are placed below the waist, kind of right in upper thigh, and we put you on this. We'll do leg exercises or ride the bike for a little while. And what happens is your muscles are not getting the venous return. So these muscles are looking for, it's taking away, it's drawing blood, but not letting the blood flow get back as quickly as it should. And doing so, you create a deficit. So you exercise, and it's not very painful. It's maybe a little sore, but that's just about it. When these bands are taken off after doing an exercise, either on the whole body vibration unit, the bike, or doing certain leg exercises, the blood comes rushing in. Now, what does that do? The blood come rushing in, brings the healing properties as well. So you have a pretty good program here to eliminate that discomfort. And it's a very solid program. It's not a quick fix in any way, shape, or form. If you've had knee pain, suppose you've been ignoring your knees for several years. Well, that's going to take some time to heal. So what happens after this is all done is it could take, we typically put people on approximately a 24 visit protocol. Some people finish in 16, some people finish in 28. So let's just say, for argument's sake, 24 visits. But is 24 visits enough to motivate you to not have a knee replacement? Knee replacements are always, that's the finality there. And, listen, a lot of times they work. I mean, hip replacements seem to be the gold standard. Very rarely hear anybody having a problem with a hip replacement, but knee replacements sometimes don't work. I've heard some people being allergic to the metal, having to do another knee replacement. And the other thing, too, is, well, the typical standard is you're going to get about 20 years out of the knee. So if you do it when you're in your 50s and you're lucky enough to make it into your mid to late 70s, there is the chance that you may need it again. So the protocols that we've outlined here are highly, highly effective, very effective. And it still baffles me as to why this lonely chiropractor in Darien, Connecticut has the only knee on track in the state. I think what happens is sometimes people don't want to spend the money to get the really good equipment in to make people's lives easier. So I hope you have a better understanding. First of all, there is hope for your knee if you want to avoid knee surgery, knee replacement. The knee on track is natural. It works. I've had a lot of great success. Recent patient, mid-70s, didn't want to have the knee replacement. And right now he walked in basically on a cane, hobbling. And here we are in the 4th week of treatment. And he is smiling again. I'm pushing him to get back to his spin classes because he's a very active, mid-70s type of guy. But there's a whole different look on his face because he's not in chronic pain. The chronic pain does have a bad effect on anybody because one, chronic pain is going to affect your frontal lobe. But you're not here to learn about the frontal lobe now, are you? You're here about knee pain and what we can do for it. So if you're interested, you can give us a call, 203-656-3636. 203-656-3636. I'm Dr. Brian McKay, and I'm very happy to offer because it's a lot of fun when someone has knee pain, they get over it and get back to living a lifestyle they want to live and can live without, cutting back on activities. So if you have any questions, give me a call. Core Health Darien, Dr. Brian McKay, 203-656-3636. If you're listening from far away, I'm more than happy to refer you to another practitioner because some people have these multiple, neon tracks. The neon track is something you really should come give a try, and especially if you want to be athletic again. All right. Listen, I want to thank you for listening. I really appreciate it. Again, if you have any questions, feel free to reach out. Have a wonderful day. And it's a little early before Christmas, but if you listen to this, give yourself a Christmas present and get your knee fixed. How does that sound? Thanks very much for listening. Have a great day.